These results are specific to this individual only. Individual results and activity levels after surgery vary and depend on many factors, including age, weight, and prior activity level.
I started playing softball at age 12. Always active, always hyper, always running, always something. I love to stay active. I like to go for walks, I like to ride bikes, I like to exercise. I hurt my right ankle about in my early 20s. I was running on the softball field and I stepped on the edge of a wet base, and that was the first sprain. My ankle was never the same from that day forward. It was always inflamed, always hurting, always warm to the touch. It always bothered me. It was always there. The pain of my ankle impacted my life a lot. I would always have to stop and rest and then start again. I could never just continue with the day in general. When I turned almost 50, I actually stopped playing because I couldn't hardly run the bases and it just hurt too much to play. By the time I stopped playing, I still loved the game, but it was not fun for me anymore. I've had 2 scopes on my right ankle. They were both helpful for about a year, and then the pain and the swelling came back as I have no cartilage left in my ankle. When I turned 51, my left knee started hurting me. I thought maybe I had twisted it or maybe overused it at the gym. I finally got to the point where it was hurting more than my ankle. I went to an orthopedic surgeon. He x-rayed my knee and said that I was a candidate for a partial knee replacement. I had walked so wrong for the last 30 years that my ankle had caused my left knee to need replacing. So I went and got my left knee replaced, and then that's when I asked him who does ankle surgeries, and he gave me Dr. Neufeld. He is the one who showed me the ankle replacement, the Infinity ankle replacement. I chose the Infinity ankle because I wanted to have an active life, and that looked like that was the best path for me. After my surgery, I was done with therapy in 6 weeks. I was allowed to put all weight on my ankle and walk normally. I was very surprised I got through rehab that fast, and so were the therapists. I knew I made the right decision on my ankle replacement 6 weeks after. I was walking with no pain, and I haven't felt that in 30 years. Before my surgery, I thought I'm not going to be able to ride my bike again, but now I can do whatever I want to do. I had my Infinity ankle replacement done 15 months ago, and I feel wonderful. I have no pain whatsoever. I originally thought I would have my ankle replaced after I retired when I turned 55. Once I saw Dr. Neufeld and he explained how fast the recovery was, I decided to have my surgery right away. I did that, and I retired just 2 months ago, and now I'm ready for life. Having my ankle replaced with the Infinity replacement is the best thing I've ever done. It's given me my life back.
There are risks and recovery times associated with surgery, and there are certain individuals who should not undergo surgery. Only a physician can tell you if this product and associated procedure are right for you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes. For you and your unique circumstances. Please consult with a physician for complete information regarding benefits, risks, and possible outcomes.